if I am suffering from diabetes or otherwise, if I am recently diagnosed as a diabetic, then what are the investigations, what are the blood tests that I am supposed to get done? So this is the usual question. This is a common question generally people keep asking me. See, when you go to a clinic, generally nowadays what they do, first they check your blood pressure as well as your sugar level. That is a GRBS, random blood sugar level they will check. So if the GRBS is little bit high, it could be 200, 300 or 400, then what is the advice generally the doctors will give? So what advice doctors were giving earlier and what advice the doctors are giving nowadays? Earlier, if your sugar level is high, then the doctors used to tell you need not worry about it. There could be a technical error. We will confirm it by doing FBS and PPBS. Don't get a panic. This was the advice that the doctors were giving earlier. So, but now what the doctors say, even if your blood sugar level is 200, GRBS level is 200, then the doctors they start scaring you. Oh, your sugar level is high. If it comes 300 or 400, again they will frighten you, telling about the complications of the high blood sugar. They scare you and they tell you to undergo certain investigations. That is the complete health checkup or master health checkup is being advised by the doctors. So, and this master health checkup or complete health checkup will be having so many tests, which includes FBS, PPBS. The basic test will be there. So, along with that, HbA1c, which is not at all necessary. If you have more FBS and PPBS, definitely this HbA1c will also be high. So the HbA1c is being advised along with that lipid profile, cholesterol, triglycerides, HDL, LDL. So many lipid profiles are being advised along with that liver function test, many liver function tests, then kidney function test, 5 to 10 kidney function test, and the thyroid test, that is the T3, T4. TSH is being advised complete blood count, that is CBC. They advise some vitamins test like vitamin B12, then vitamin D and other vitamins also they advise you to undergo. And then along with that certain minerals and urine checkup. So in that urine routine will be there, along with that urine protein level, urine albumin level, everything they advise. Even some of the doctors advise you to undergo scanning, which is not at all necessary. Ultrasound, even some say tell you to undergo this X-ray. Even some I have seen someone advising to undergo CT scan also. Is this necessary? It's almost 80 to 100 tests what they advise. Is it necessary? If you ask the doctor, is it necessary? Then what they say, have to undergo because see your blood sugar level is more. So this may cause your organ damage. So but one thing is the organ damage due to diabetes will be there in case of a long term. That is, if you are suffering from diabetes for many years, like 5 years, 10 years, or 20 years, then only this organ damage will be there. Otherwise, if you have a diabetes, which is a fresh, recently, last 3 months back, it was normal, but now it is showing 300 or 400, then definitely no changes will be there. Even if you are suffering from diabetes for the past 1 or 2 years, then also there won't be changes in any organs or any investigations. So even if there are changes, so like your cholesterol is more or kidney function is abnormal or your liver function is abnormal, then it is because of the diabetes. You don't have liver disease, you don't have kidney disease, but the abnormality what we are seeing will be because of the diabetes. So what we are supposed to do, we are supposed to correct diabetes. So root cause is diabetes. Root cause of organ damage is diabetes. So we need to correct our diabetes instead of correcting those organs. Again, this can't be done. If there is a kidney damage or abnormal liver function, you can't correct it. We don't have any medicines for that. What we need to do? Correcting the diabetes. Correcting the diabetes in the sense completely curing the diabetes can only reverse whatever the abnormal blood reports that you get. So my advice, my suggestion is, this is an useless. If you are diagnosed as a diabetic, undergoing all the tests is an useless. It's just simply a business. Second thing is it creates a fear. So again, you will be in fear, like, oh, what blood reports will come. Again, even after seeing the blood reports, certain they will mark it as a red, or they will make it quite a dark if it is a borderline. Again, they would say, see, this is borderline. This is a little bit high. So your TSH is supposed to be 5.5. It is showing 5.6. So this is abnormal. Again, you will have that fear. That fear will get into your mind. So mentally, you will suffer as well as physically. Initially, you'll be having a stress. Again, that enhances, that increases your sugar level as well as your blood pressure also. So along with this, third thing what you will suffer is you will lose money. This is an unnecessary test. You will be spending thousands of rupees on this. So this is a useless test. So you will be losing money and somebody else will be making money out of you. So it is my advice, if your sugar level is more, if you randomly check and your sugar level is 200, 300, or even if it is 400 also, so you need not get a panic. Don't worry. Don't get panic. Then what you are supposed to do, just confirm it. Even if you have sugar level high, it's a fresh one, which can be 100%, it can be reversed. So what you are supposed to do, you are supposed to confirm that you have diabetes. How to confirm it? Simple test, basic test what we have is FBS and PPBS. FBS is fasting, at least 8 to 10 hours of fasting blood sugar, and postprandial, that is 2 hours after your breakfast. FBS and PPBS are enough, sufficient to diagnose, to confirm your diabetes. And even if you have diabetes, your FBS and PPBS is more, then again you need not get a panic, because it's a fresh case and it can be 100% reversed without medicines. Don't get panic and don't start medications. You can 100% you can reverse this diabetes, a new case of diabetes. Again, in the name of a disease, people create fear. They keep frightening you. This is because they can make a business only out of your fear. If you are in fear, then only they can make money from you. So don't let someone to make money out of your fear. So if you need any scientific information, exact precise information about health, then only subscribe to our channel. Be happy, stay healthy. Namaste.